Hello all, welcome to Study MRCEM OSCE video series. Myself Dr. Sree Krishnan TP, your course director at Study MRCEM. So we are going to come up with an exclusive series of videos on YouTube and our various social media handles on how to prepare for your MRCEM OSCE. So the first video that is you're going to see here is to have an overview of how the MRCEM OSCE is done, and this will give you an idea on how to appear for your exam. And upcoming videos will be on different station on how to handle each station in detail. So the whole purpose of this presentation is to make you understand how you will be able to go forward further for your MRCEM OSCE. So, the content that we will be discussing here today will be the structure and how the MRCEM or MRCEM OSCE is structured, and what all stations that you need to anticipate, what is the time allotted for each stations, and what to expect in each station in a brief, and which all domains are tested. So that will be the idea for the next 10 to 15 minutes. So, structure and content of the MRCEM OSCE. So, basically, MRCEM OSCE consists of an objective structured clinical examination, which you are all aware, and objectively samples the clinical and communication skill of trainees and ensure that they are those of someone ready for entry to higher training. So, the most important one, what you need to keep in your mind is that what we are looking into in the OSCE exam, whether the candidate have an knowledge of that who is going to enter as a day one as a registrar in the Department of Emergency Medicine in UK. So how much knowledge at day one a registrar that should be having at when they are entering into the UK system is what they are trying to assess. So again, IELTS is not mandatory, but it is expected to have an IELTS standards level of 7 that is expected, and on completion you will be awarded the diploma, that is the member of Royal College of Emergency Medicine. So look at the structure here. These are the stations that you are anticipating. This is directly taken from the blueprint of the RCM. So there will be 16 station. Meanwhile, there is given 18 station here. 2 of them will be rest stations. So out of 16 stations, you need to have understand that each station carries 10 marks. So totally you will have 18 stations and you will have 2 rest stations. So that is what you have to keep in your mind. So that is what total 16 station and 1 minute to read the scenario. So prior to going into a station, you will be given 1 minute where you will be reading the scenario and understanding what needed to be done next. And 8 minutes to perform. You will be given 8 minutes to perform, and there will be 2 rest stations, which I have already discussed. So what to expect in each station? So you have seen that you have already done your SBA. So you will be already available. There is something called as SLOs. That is the specialty learning outcomes. So each one of the station is mapped into a certain SLO. So you can see at the first 3 stations, it is mapped into complex stable patient, and it is SLO1. So it will be basically a complex, but the patient will be stable and it will be from the SLO1. So you look at the MRCEM curriculum and RCM curriculum, you will know that SLO1 start with ENT, ophthalmology, you will have gynec, you have hepatology, you have endocrinology, all those things will be there, and you will be given a scenario of a complex stable patient from any of this SLO1 area. Next, you will look at to the next SLO2 answer to the question, that is the classical history taking station. Then going to the next is the resuscitation station, which is very, very important, that you need to clear at least 1 station out of 2. So if you are not doing well in 2 of the station, even if you do well in other station also, literally you are failing in that MRCEM OSCE. So out of the 2 resus stations that you are receiving, out of 2, 1 you have to mandatorily clear. So all your resuscitation, ALS, 8ALS related stations will come in here. Then goes to the next SLO4, that is the injured patient. So injured patient, it can be a hand injury, or it can be a knee joint injury, or it can be cervical spine injury, anything of that sort, and multiple domains will be tested. We'll come to domain. What do you exactly mean by domain? I will be coming that very soon. And pediatric emergency medicine is the next slot. So pediatric emergency medicine, yes, that is the most important one. You have to have common pediatric emergency like a febrile seizures, acute diarrheal disease, croup, bronchiolitis. All those things you should be able to identify, and you need to be able to treat the patient accordingly. And even hypothermic pediatric cardiac arrest also can be a scenario. Then come the procedural skill station. So procedural skill station can be a mix and match of skill and supervise and procedure skill together. It can be a combination of maybe teaching as well as a procedure skill station together can come. So for example, I have been asked to do an RT line insertion. Meanwhile, I am also asked to connect how to connect the RT line. So this can mix and match and come. Then you have the complex and the challenging situation where it can be psychiatric station, you have a difficult referral or breaking a bad news. So all those things is what we have to expect in complex and challenging situation. And supervise and teach, we have already told you what is to be expected. It can be a pure teaching station like teaching an ECG or teaching a procedure or teaching a block, etc. But it can come with a combination with the procedural stations also. So now comes the biggest question, what do you mean by domains? There are 7 domains which will be tested in your MRCEM OSCE, and each station, you have to be very, very clear here, each station 1 to 4 domains will be assessed. So in each station, minimum 1, maximum of 4 domains will be tested. So what are those 7 domains? One is clinical reasoning and decision making, communication skill including conflict resolution, history taking bar information gathering, clinical skills, practical skills, teaching skills, and organization and prioritization skills. So we are working in ED, it's very, very important to have a good organizational skill. So how will you do triaging? When you have 10 patients coming to the emergency, you have only 3 beds available. How will you manage them? So these sort of things, what do you want to anticipate in organization and prioritization station? So we have to be very clear, out of these station 1 to 4 domains will be tested in each one of them, and each domain will be weighed separatively in relation to its overall importance. So every domain may not carry equal importance. Suppose communication skill will be little bit less, suppose in other station communication skill will be very, very high, and candidate will be judged by for each domain, and that marking will be done by the examiner. So there is no checklist for the examiner. So many of you will be aware there is no checklist. So for each domain, you have to see the screen here. For each domain, what is shown in the screen, the examiner will put you the mark for that domain. Suppose communication skill and practical skill was the domain. Communication and practical is 50 by 50. So the total mark will be 5 for communication and 5 for the practical skill. And suppose you are doing it extremely well, you will be given 4. If you have done very poorly, you will be marked 0. So 0, well below minimum competence, and well above level competence is 4. Somewhere in between 1 to 2, 3 will be given according to that. So that's what very, very important. So each domain will be tested, and that will be weighed accordingly to the weightage of the domain. So how will you know that? That is the pie chart. So pie chart, you have to look into the pie chart and see, okay, 50-50 means each domain have got equal weightage. Suppose it is 70-30 is the pie chart, one domain is superior and another domain the marks are less. So we have to understand that maybe 4 domains will come 25-25, or it can be 60-30-10, or it can be 60-20-20, or it can be 50-30-20-10. So depending upon the complexity of the scenario, they will decide, and maximum 4 domains will be tested. So examiner, and again what does the examiner do? Examiner will do the domain based scoring. Also on the performance of the station overall, they will mark you whether you are a clear pass, borderline pass, or whether you are a borderline fail or a clear fail. So depending upon that, examiner will mark you again. So the examiner will do 2 things. Each domain he will put a mark, and overall performance for the station they will give you either clear pass, borderline pass, or borderline fail, or clear fail. So this is the pie chart that I was talking about. So you should know there are 3 domains here: communication, reasoning, and history taking. So depending upon that, the examiner will mark you what is the mark, and for each station it is 10 marks. So cumulatively it will be 160. So out of 160, you cannot predict that this much mark is enough. So you have to do research station out of 2, you have to clearly pass 1, and it all depends upon how on your given day your colleagues are practicing. The results will depend upon that. So previously you can say out of 16 you've cleared 12, you will be passing. But here we cannot definitely say, because each station your marks might be different. So overall cumulatively, even if you're doing some station badly, maybe you're getting 4 marks also, that will be added on to your total score. So maybe you have done 2 stations very bad, 4, but your station, some station you have done good and others briefly, reasonably well. So all cumulatively you need to get that mark. But remember that out of 2 races, you have to clearly pass at least one of the resuscitation station. So what is the key thing that you wanted to get succeed here? What is the main reason of this video, you should understand the format and use only official resources. Practice, practice, practice. So practice is the thing, only thing by which you can succeed in this exam. And regularly focus on your core clinical skills. Get feedbacks from your colleagues, how you are doing. Develop a systematic approach. Even if you don't know, if you haven't practiced, but you have a systematic approach, like you are going and greeting the patient, you are introducing yourself, and that itself will give you some marks. So you should have a systematic approach and brush up your anatomy and pathophysiology. Very, very important, especially nerve block, artery line insertion and all. You need to know anatomy and all. Stay calm and composed even if you don't know one station. That doesn't mean that you are going to fail in that exam. So stay calm and try to do whatever is possible with the given time. You should have a structure and opening remarks and closing remarks, and maybe in between somewhere you would have seen your emergency room. Try to resolve. Maybe you will get 5 marks and you might be having a borderline pass also. So that all depends upon your luck on that given day. And time management is very crucial. How will you get the time management? By only doing practice. Do attend mock exam. Do join our courses, and where our expert mentors will guide you on how to deal with these exams. So that is the reason why you can come and practice with our mentors who are well trained in MRCEM OSCE. So they will give you an overview and feedback that how you are performing, and corrective things will be very, very good for you. And also you should have very good communication skills. Without communication skills, don't think about appearing for your MRCEM OSCE, and stay always updated. So if you have any queries, you just drop it in the comment section. We'll be there to answer those. Thank you. On behalf of StudyMEDIC family, Study MRCEM, thank you each one of you for attending this video.